Good day everyone! So my task is to report the scientific method of an integrative approach by William Shakespeare, who wrote What Past is Prologue. So there are three traditions or ways of thinking about causes psychopathology. First is supernatural, biological, and lastly is psychological. Supernatural explains about psychopathology are still with us. Superstition prevail, including beliefs in the effects of the moon and the stars on our behavior. So this tradition has a little influence on scientists and other professionals. However, biological, psychoanalytic, and behavioral model by contrast continue to further our knowledge of psychopathology. So there are two major historical components. First is psychoanalytic and second is behavioral. First, scientific methods were not often applied to the theories and treatments within a tradition, mostly because of methods that would have produced the evidence necessary to confirm or disprove the theories and treatments had not been developed. Lacking such evidence, many people accepted various fads and superstitions that ultimately proved to be untrue or useless. King Charles VI was subjected to a variety of procedures, some of which have since been proved useful and others that were mere fads or even harmful. Second, health professionals tend to look at psychological disorders narrowly. From their own point of view alone, Gray assumed that psychological disorders were the result of brain disease and that other factors had no influence. Watson assumed that all behaviors, including disordered behavior, were the result of psychological and social influences, and that the contribution of biological factors was inconsequential. The most notable was Adolf Meyer in 1866 to 1950. Often considered the dean of American psychiatry, whereas most professionals during the first half of the century held narrow views of the cause of psychopathology. Meyer steadfastly emphasized the equal contributions of biological, psychological, and socio-cultural determinism. Although Meyer's ideas had some proponents, it was 100 years before the wisdom of his advice was fully recognized in the field. By 2000, a veritable explosion of knowledge about psychopathology was occurring. The young fields of cognitive science and neuroscience began to grow exponentially as we learn more about the brain and about how we process, remember, and use information. The National Institute of Mental Health instituted a plan to strategize, a plan to support further research and development on the interrelationship of these factors with the aim of translating research to frontline treatment settings. Understanding psychopathology is a psychological disorder or dysfunction within an individual that is associated with distress or impairment in functioning, and a response that is not typically culturally expected. And all of these three basic criteria must be met. No one criterion alone has yet been identified that defines the essence of abnormality. And the field of psychopathology is concerned with the scientific study of psychological disorders, trained mental health. Professionals range from clinical and counseling psychologists to psychiatrists and psychiatric social workers and nurses. Each profession requires a specific type of training. Using scientific methods, mental health professionals can function as scientist practitioners. They not only keep up with the latest findings but also use scientific data to evaluate their own work, and they often conduct research within their clinics or hospitals. So research about psychological disorders falls into three basic categories: description, causation, and treatment and outcomes. The supernatural, biological, and psychological traditions, historically, there have been three prominent approaches to abnormal behavior. In the supernatural traditions, abnormal behavior is attributed to agents outside our bodies or social environment, such as demons, spirits, or the influence of the moon and stars. Although still alive, this tradition has been largely replaced by biological and psychological perspectives and the biological tradition disorders. And the disorders are attributed to disease or biochemical imbalances. In the psychological tradition, abnormal behavior is attributed to faulty psychological development and the social context. Each tradition has its own way of treating individuals who suffers from psychological disorders. Supernatural treatments included the exorcism to rid the body of the supernatural spirits. Biological treatments typically emphasize the physical care of the search for medical cures, especially the drugs. Psychological approaches use psychosocial treatments beginning with moral therapy and including modern psychotherapy. According to Sigmund Freud, the founder of psychoanalytic therapy, offered an elaborate conception of the unconscious mind, much of conjecture. In the therapy, Freud focuses on tapping into the mysteries of the unconscious through such technique as catharsis, free association, and dream analysis. Although Freud's followers steered from his path in many ways, and Freud influence can still felt today. One outgrowth of Freudian therapy is humanistic psychology, which focuses more on human potential and self-actualizing than psychological disorders. Therapy that has evolved from this approach is known as person-centered therapy. The therapist shows almost unconditional positive regard for the client's feelings and thoughts. The behavioral model moves psychology into the realm of science, and the behavioral model moves psychology into the realm of science. Both research and therapy focus on the things that are measurable, including such techniques as systematic desensitization, reinforcement, and shaping. Okay, the present, the scientific method, and an integrative approach. With the increasing sophistication of the scientific tools and new knowledge from cognitive science, behavior science, and neuroscience, we now realize that no contribution to psychological disorders ever occurs in isolation. Our behavior, both normal and abnormal, is product of a continual interaction of psychological, biological, and social influences. Thank you so much. Hope you understand my topic